Hello guys, here I'm gonna share my paper accept in BMVC, which is about using mutual contrastive low rank learning to disentangle whole slide image representation for achieving better glioma grading. This is the outline of my presentation. Firstly, I will introduce my background of this project from glioma grading and whole slide image. And then I will introduce more detail about related works. Finally, I will show my proposed method and related result. Firstly, glioma is a type of brain tumor, and this disease is quite common, but it will threaten people's health and kill people in 2 or 3 years. Generally, the clinician will divide glioma into 4 grades. The grade 1 is benign tumor, so we will not consider it here. Grade 4 represents the most aggressive type, and the lower grade glioma LGG, such as grade 2 and 3, are less aggressive. From the right bottom image, we can see the different grades have different look and type of pathology, histology, and molecular type. And between the different grades, there are some quite similar histology and molecular type, so this may cause the heterogeneity or diversity. For the aim of the grading, better grading can help clinicians make more tailored surgery and therapy. What can we use for glioma grading? Generally, the pathology will use whole slide image to decide which level the patient belongs to. WSI is a kind of scanning of conventional glass slides in order to produce digital slides. WSI also can divide into 2 sorts. FFPE, which is made by formalin, it can have long-term storage and provide clear cell and tissue morphology, but it's quite time-consuming and different center may use different preparation. Moreover, formalin also causes some artifacts. For frozen section, of course it's quick, and the hydration and cellular morphology have more natural state, but it has short-term storage and boring poor quality. However, if we want to analyze WSI by automatic method, we will face some challenges. Firstly, the size of WSI is quite large, and for dataset of glioma, we only have weak annotation. Based on the previous introduction, 2 modalities are quite promising to complement each other because they have their own advantages on representations. So, how to achieve a multi-modality learning is a challenging question as well. Moreover, because of heterogeneity of glioma, we need to decrease the intra-class variance and increase the inter-class margin. For large WSI size and weak annotation, we can apply multiple instance learning here. However, before the multiple instance learning, we need to do a data pre-processing. For example, we can segment tissue from the different magnification, and we will split out many patches from WSI so that each patch can be available for deep learning training. In next training phase, many interesting methods was proposed. For example, in 2018, attention mechanism was first applied into MRL. We can use future vector to calculate attention weights for each patch's future vector. Recently, some people modified transformer and achieve better performance on multiple instance learning. Moreover, some people also improve the structural attention by employing multi-attention branch and instance-level clustering loss. But most of researchers focus on the second patches level integration section. Many use ImageNet pre-trained weight to extract patches feature, and nobody considers to combine two modalities to further improve the feature extraction. Therefore, in order to solve the challenge, we can apply the mutual and contrastive learning into all tasks. Because mutual training simplifies the joint optimization and contrastive learning, it can promote because contrastive learning can promote better representation learning. Therefore, in recent years, the combination of mutual scheme and contrastive learning was applied into many applications and achieved many big success, such as image caption and video text joint representation learning. Meanwhile, this is a key reason why we use a similar idea here. In order to solve the heterogeneity of glioma, we got some idea from low-rank. Based on the first paper, low-rank regularization can achieve more robust representation learning and avoid noise influence. And second study focused on the auxiliary loss by making orthogonal low-rank embedding. Based on the related work, I made some improvement on my project. Here, we can see overall training scheme of my proposed method. Firstly, we will random sample one patches from each modality of same patient. The images will input into two backbones respectively. The future embedding after nonlinear transformation will be used for contrastive learning and calculating low-rank loss. The sum of mutual contrastive low-rank loss and each classification loss will be used for backpropagation. Next, I will give you more detail about these three parts. Based on the finding of SimCLR, we can know nonlinear transformation can remove the influence from color, which may caused by different standing procedure from multiple centers. In contrastive loss, I made a change here. In the original contrastive loss, it will use L2 normalization on feature vector, but in all tasks, the image pairs include two domains with different distribution. Therefore, I adopt layer normalization to recenter and rescale the latent space into the Gaussian distribution. Other parts are quite similar. Moreover, I also adopt low-rank loss to solve the image of to solve the challenges of the heterogeneity. In each modality, we concatenate two future embedding from vertical direction to obtain new matrix. Finally, we define the loss function like this. In this equation, we pick up related future vector from the same class based on the label and calculate the left term. This can achieve to decreasing the intra-class variance, and the right term can be regarded as a regularization term and achieve and it aims for orthogonalization and increase the interclass merging. In the classification, we adopt Taylor softmax to estimate the softmax, and it's for reducing the overfitting. The form of total loss will be like this. Each loss is for each network's back propagation. This is my experimental setup. I split my dataset into training, validation, and testing sets. We did some related data pre-processing. Meanwhile, I use some data augmentation here. I choose EfficientNet as my backbone in basic testing. I use the majority voting to evaluate the performance in patient level. Meanwhile, I also used my trained model as feature extraction backbone to combine with the attention-based multi-instance learning protocols. From quantitative results, we can see our training scheme improved the single training one modality and training or mix images from two modalities. Furthermore, our training scheme also improved the feature extraction and boost the performance of multiple instance learning. Moreover, we also compare other classical contrastive laws and show the sensitivity of temperature, different temperature hyperparameter. We visualize all latent space from testing datasets by UMAP. These results show our proposed scheme can promote multimodality and discriminative representation disentanglement because our method can help feature extraction into a closer distribution. In addition, the classification activation map also can show our proposed scheme focus on the proliferation region with different levels. In conclusion, the mutual contrastive learning show a robust performance, and it can be regarded as a reference for future development on multi-instance representation disentanglement. That's all my presentation and the introduction of my project. Thank you so much.